Over the years, one of our more common injuries that we see, or people that come in and reach out to us about, is shoulder injuries and shoulder issues, whether it's frozen shoulder, adhesed, stuck, limited mobility, whatever that looks like. This is such a common thing that we've seen. And again, over 20 years of working with clients, this is probably one of the most common things that we see and definitely help folks with. With shoulder injuries, as we look at them and what is going on, there's a lot of times there's different factors that can be contributing. Sometimes it's just like a slow onset. Sometimes it's like, oh yeah, I fell and this happened and now I'm really restricted. There's, again, a lot of times we need to ask some good questions and find out what's going on and have a better understanding of, I call it, the causative factors. When this set up, how it started, and having a better understanding of what's going on and how that person is being affected by their shoulder or the lack of mobility with that. So after we do that, we really want to delve in there and understand what's going on, because with the shoulder, it's such an interesting thing. We've got 17 different muscles all around this ball and socket joint. So again, the shoulder is very unique because it is a ball and socket joint, and we get so much range of motion with that. We have the ability to be able to come straight up like this. We can bring our arms straight up like this. We have internal and external rotation of our shoulder. So it does a lot of ranges of motions. So again, we have all these 17 structures in and around there, as well as countless ligaments, as well as the bony structure of the collarbone, the shoulder blade itself, and how it attaches and struts in with basically our arm and our spine and stuff like that. So again, very integral function, but again, it definitely leans itself to instability. Now, a common thing that people will say is, oh my gosh, they feel that they have a torn rotator cuff. And that could be the case. But more times than not, we find that they don't have a torn rotator cuff. They just basically have other things that are restricting to that. Another common thing that we'll see with shoulder injuries is also what we'll call a labral tear. And a labral tear is basically, as we look at the shoulder, and if this is the socket, basically, that the shoulder and the arm is going to come into it just like this, it is the cuff. And the cuff is the material, which is like a gelatinous or a cartilaginous material that comes all the way around there. And it comes in and it basically helps to seal all around this part of the ball and actually helps to seal that shoulder or that arm into that socket. Now, a lot of times with a labral tear, we'll see what's called a micro tear. We can have major tears or a micro injury or a micro tear. And it can be anywhere along that cuff that actually creates a micro tear. And as that does that, it creates more or less like an abrasion. So we've all had something come into our eye before, right? Maybe you get a little piece of dust or an eyelash or a piece of sawdust if you're working around, materials or anything like that in the garage, or sawing a piece of wood. And if you get a little piece of sawdust or an eyelash in your eye, you can feel it every time you blink, right? And that's a common thing. Well, it's the same thing with a shoulder. If we have a micro tear of that labrum with certain movements, we're going to feel that little abrasion in there, and it's going to be an irritant, and it's going to definitely let you know that. Now, there's definitely some orthopedic and some exams that we can do that we can determine if it's a labral tear. Obviously, the gold standard to really find out if we have labral tears or anything like that, or if we have a tear of our rotator cuff, is going to be getting an MRI, doing that diagnostic imaging. Maybe you've had that diagnosed. Maybe we get that assessed. But at the end of the day, getting the diagnosis can be helpful, but it's all about what are we going to do as our protocol and what are we going to do for a treatment protocol. And that's where we come in. So, hi, I'm Dr. Sweeney, and I've been practicing here in Austin for a little over 20 years and doing a little known technique called the Nuka method. Now, the Nuka method is a very radically different technique. We do not employ any form of traditional twisting, popping, or cracking that's normally associated with most forms of chiropractic. In fact, it's a very gentle, predetermined technique where we use predetermined pathways that come from our very specific x-rays that we take, where we look at the head and the neck and the relationships of what's going on with the head and the neck. We take 3 very precise pictures, 3-dimensionally, so we're looking from a view from the side, from the front, and top down. And then with that, we can really model what's going on within the spine and how that may be implicating you. And now you say, well, how does this implicate or how is this affecting my shoulder? In all ways it is because everything that happens from down into the shoulder and all of that, they're getting all those nerve and impulses from our head and neck, and specifically some of the nerves, specifically one of our cranial nerves, which is cranial nerve number 11, the spinal accessory nerve. That is coming down and innervating the muscles of the shoulder, the scapula, and can have a big impact. So we want to make sure that those nerves are communicating well and having the best signal, and they're not being impinged by some sort of dysfunction or cervical instability. So what it is that we do, again, we take a careful history, we delve in and do an examination, a detailed examination, a detailed postural assessment, looking at that, taking those precise x-rays to understand how your body may be compromised, and then what we need to do to go about coming up with a protocol to actually helping to correct your spine and helping to get your body back to functioning and working the way it was intended to. So if you've been dealing with this and maybe you have some exercises or you've tried different things, you can always reach out. But here are some at-home exercises or some tips that I'm going to actually recommend, and I recommend for all my clients that come in to see us. So the first one is I'm going to recommend doing shoulder circles. So I call it the backstroke. So we're going to do backstroke motions like this. We're going to always go backwards, not forward. Okay, so we open up that shoulder girdle. The next exercise that I like to do is keeping your thumb up like this. You're going to bring your thumb up, and then you're going to cross your body, turning it in. So thumbs down like this, and then thumb back up. And you can look at your hand, and then look at your hand down through here. And as we do that, that actually is taking our arm through that internal and external rotation. Okay? The next one is to use a knife edge with my hand and actually do massage in and around, or find tender areas in the armpit area right through there, between like my armpit and my shoulder blade right through there. And you'll find a spot, and you just kind of work on that. And that's going to be a really good thing. I also like to use a tennis ball. So if I were to have a tennis ball and take a tennis ball and actually put it along my spine and along there up against a wall, and actually leverage my arm and maybe even move my arm around while I'm up against the wall, working that around that ball and finding those trigger points to actually break that up. Other things that I like to do are using bands, exercise bands, and we place those high up in a door frame or high, anchoring them high, and then we're going to use the motion of actually pulling them down and then letting them pull our arm back up. And we're doing that to actually help to get more mobility so we can raise our arm up. It's not uncommon for us to see with a lot of our clients that come in here, they can't bring their arm above 90 degrees, whether it's in a forward position or in a side position. They're usually stopping right through here. I'm going to call it, they make the classic T. They can't bring their arm all the way up like that. So we want to do that. So we're going to do both those motions. The other thing is taking that band, and you're also going to do shoulder retractions. So we're going to kind of almost do like a row, but again, it's going to be anchored up high. Those are some great exercises and some physical therapy tips that are going to actually help facilitate getting things moving a little bit better. Now, again, if we've got this adhesion, again, it'll help release some degree, but there's still more than likely some form of, again, as I call it, cervical or other instability in the spine that may need further help. So if you're still dealing with this and still dealing with issues and would like to get better answers and maybe have us help you facilitate and actually making this work better for you, then reach out, contact our office. We'd be happy to talk to you. We'd be happy to set up a free consultation where, again, we can get a better understanding of what's going on with you, and then how we can come about actually coming up with a solution to you, and that's going to be custom tailored to helping resolve your issues. So until we see you, until we talk, farewell, be well, and be grateful.